Joining us now to continue this conversation is Democratic Congresswoman Becca Balint of Vermont. She's a member of the House Judiciary and Budget Committees. Congresswoman, I hope you were able to hear some of that conversation. So I'll begin by just letting you react to $4,000 a month when she looked in the portal, initially a total of about $50,000.
That's right. I mean, this is what we've been trying to convey for months now, that these are real people that are going to be impacted by these subsidies going away. These were the stories that we tried to highlight in committee and on the floor of the House. And Renee's story is not singular. Right? As she said, there are many, many Americans across the country facing that same situation of essentially having to gamble with their health. And I know here in Vermont, you're looking at many of the premiums doubling, some even tripling, and people just can't afford it. And so they're going to make the decision, the horrible, horrible decision, to take a risk and have no health care coverage. And of course, that is horrible for those individuals and those families. It creates so much anxiety and fear, and then you decide not to get health care until you're very, very sick. And then that impacts the entire system. And so we knew this. And it's why we kept saying to the Republicans, we have got to extend these subsidies. People simply cannot afford their health care, and millions of people are going to go without. And so we do have a bill that will be coming to the floor to extend the subsidies for several years while we figure out how to reduce costs more broadly. But this is not a time to cut people off of their health care while we try to figure it out. Let's give them the peace of mind they need.
Yeah, you brought up an important point about the legislation. The House is set to vote this week on the 3-year extension of the subsidies. It is expected to pass your chamber. It is not expected to pass in the Senate. What is your understanding as to why Senate Republicans and the President of the United States want to block Americans from getting affordable health insurance in this country? I mean, how do you get the Senate on board at this moment?
Yeah. To your first question, how do I make sense of this? I can't make any sense of this. There is no making sense of it. Republicans for 15 years have been trying to repeal the Affordable Care Act. For 15 years, they have never offered an alternative. And here we are at the 11th hour, and they are saying that we have money to fund war against Venezuela, but we don't have money to make sure that Americans and the richest nation in the world have health care coverage. So I will say to everyone watching this is when we have to do our part as Americans and call those senators and say, this is our lives you're talking about here. This is not some game, and they have nothing to offer. There is no plan. So pass the House bill, get the extension, then we can do the work to figure out what comes next. Myself, I want Medicare for all. That's what I want. And that's what a lot more businesses are saying they want, because there's the other piece of this that I wanted to mention. Got 78,000 small businesses in Vermont. Their employees are on the exchange. They can only employ those people because their employees are on the ACA programs. Without them, they're going to lose their workers. It's going to impact the economy broadly. And it doesn't have to be this way. This is a policy choice that Republicans are making. And I think it's, frankly, I think it's cruel. I think it's cruel.
Congresswoman, I want you to take a listen to an interview that our colleague Maya Eglin did with a woman from Texas who has stage 3 endometrial cancer. Take a listen to this.
If I don't have my insurance, I literally I'm going to die this year. That's the brass tacks, unfortunately. I won't be able to afford my medication. I won't be able to afford my treatment. The possibility of the cancer coming back or not being completely gone is inevitable, and I won't make it.
Her name is Joanna Scott, and I was really moved by her interview the other day because it was a very helpful reminder that, as you know, here on cable news, we talk to people about the political stakes here, how this is going to shake out in D.C. But for some people, this is life or death. She told my colleague Maya Eglin that even if an agreement works out in the first couple months of 2026, she literally may not be alive by the time that agreement is worked out.
Yeah, and I'm so glad you're highlighting these stories, because that is what it will take to change the political conversation. And, you know, I'm routinely shocked as a member of Congress what it is that we spend our time on and what we spend our energy on and our money on when there are people right now who do not have health care coverage to keep themselves alive, or they're going into bankruptcy because they can't afford their health care. In the richest nation in the world, those are the times when I get the most exasperated as a member of Congress, when I hear those stories and I think, why are we not voting on this? You know, not today, but why didn't we vote on this months ago when we knew this was coming? We absolutely knew this was coming, and we were sounding the alarm. And people told us we were exaggerating. We're not exaggerating. It's about life and death for so many Americans.
Yeah, it absolutely is. It's not about numbers. It's about people. Congresswoman Becca Balint, thank you so much. It's always a pleasure to have you on the show. Thank you.